Good afternoon, all telehealth members. How's everybody doing today? So, I know that the COVID-19 vaccine is out, and everybody has many questions of figuring out, where do I get one? Where do I go to get it? Does it come to me? Do I go there? Is it for free? So, I have some of your answers, not all, but I can tell you what I know. So here we go. The distribution of the vaccine will begin the week of December 21st. So last week there was a lot of testing going on, but the 21st, this week is when the distribution happens to all. Now, who is included into that group? It says here that the healthcare workers who are at a high risk of exposure to the COVID-19 and the staff and residents of long-term care facilities are being prioritized to receive immediate vaccinations. So, you guys are under the umbrella of the new Franklin nursing home. So once the nursing home gets it, we can all get it. Me as a healthcare worker, everybody here, we're gonna get it. Plus anybody that comes to this place will get it as well. Also, they keep talking about that it shows to be 95% efficient, preventing symptoms and decreasing severe COVID-19 infection. Says here that the vaccine works by teaching the body how to create an immune response for the virus. This is not that is not present in the body. Also, this vaccine requires 2 doses. A shot in the arm, 3 to 4 weeks apart from one another. All right? So, good news is that we are the first people to get it. Me and you guys included. Why? Because you guys come to New Franklin. So we don't want to stop that from happening. Once we get better direction on how you guys are able to get it, we'll be calling each and every one of you guys to let you know the news. Okay, so it says here when and where to get vaccinated. COVID-19 vaccines may not be widely available to the general public until mid-2021. Yes, mid-2021 is, well, roughly around June. That's 6 months into it, yeah. So, the vaccine will be available in stages. It'll be offered first to the people who work in the healthcare and are increased risk of getting the COVID-19. So, we're up at bat first, you guys included. This includes people who take care of the COVID-19 patients or work in the areas of a facility where COVID-19 patients have been. The vaccine will also be made available to first responders and nursing home residents and staff. Okay, let's continue further. The vaccine will likely be available to the following groups next: the essential workers who interact with the public and who are not able to physically distance, people at higher risk of complications, whether you're obese, have underlying conditions or issues like diabetes. When there are enough vaccine doses available, it will be made available to all New Yorkers. So, you know how you could go get your flu shot if you go to a Rite Aid or to a CVS? I'm assuming they're going to have the same protocol, but don't quote me as of now. It's very general, the way that they are writing this out. You will likely be able to get the vaccine at the same place you usually get vaccines, such as your healthcare provider, community or hospital clinic, pharmacies, or urgent care centers. So, there you go. You can get it from your doctor, you can go to a clinic, or you can go to your pharmacy, or to an urgent care. Some COVID-19 testing sites and community pop-up locations may also provide vaccinations. The vaccine currently in trial has not been studied in children younger than 16. They will not be available to that age group until more information is available. Fair and adequate vaccinations. I know that we live in a crazy time, and some people might think, how come this person gets it over me, and vice versa. So right here it states that the health department will ensure that there is a fair and equitable access to the vaccine. Our plan accounts for health inequities and disparities faced by underserved communities. We will make sure the community hit hardest by the pandemic have access to the vaccine. Well, I know a lot of people are worried about, what about my young ones? What about my nieces and nephews? They are not going to be given to that because it is said once before that their immunities as a young growing person will be able to overcome this better. So maybe it's not needed for them until further notice. Okay, the safety. The FDA, the Food and Drug Administration, is overseeing the approval process for vaccines. It has released safety and efficiency guidelines for companies working on a vaccine. As these guidelines make clear, the COVID-19 vaccine under development and in trials must follow the same rigorous safety rules as any other new vaccine. The FDA will only grant emergency use authorization if it decides the benefit of the vaccine outweighs its potential risk. So, this vaccine is for all. Doesn't matter what creed, what race, what gender. This vaccine is also for free. So you don't have to worry about insurance. You don't have to worry about if you have to pay out of pocket. You go and you get this for free. Okay? But this is going to be breaking down in different stages, like I said before. The elderly, the people that are residents at nursing homes or are registrants for adult daycare like ourselves, and healthcare workers, we are the first at bat to get it. So sit tight, relax. We will let you know when and where. Okay? With that being said, although the vaccine is here, right now is not the time not to be responsible and say, oh, the hell with this mask. I'm going out. I'm going to go have lots of friends come over my house. No. Not just yet. I know this year has been weighing a lot on us, and life is different now. I understand. But if we made it through all this time without the vaccine, just give it its course. You will have it too, and life will get back to normal. So, continue washing your hands. Stay 6 feet apart and wear your face mask until further notice. With that being said, guys, take care, everybody.